Hi, this is Dr. Diane Gehart, and welcome to my lecture on progress notes that goes with my textbook Mastering Competencies in Family Therapy, the second edition. In this lecture, I'm going to talk about how to write progress notes, and you will find that these are one of the most common clinical forms of documentation. And as you work in the field as a therapist or counselor, you'll be completing several of these each day. So hopefully this lecture will get you started. So progress notes are the document that you complete every day after seeing a client in a typical session. And what happens in this document is it is the official record of what happened and what you did. So on the one hand, the most basic reason for doing progress notes is for you to keep a record of what you're doing from week to week to kind of track your sessions in care. So that's the most basic purpose of a progress note. And in the larger sense, there's an ethical and professional standard for maintaining these because it is the only real documentation we have. It's a field where we sit in a room and we talk to people, and then it's based on our word what we did. And so we use these progress notes to document what happened. And so these are very important for third-party payers to keep track of what happens if there's ever questions about what happened in session. And similarly, progress notes can be helpful in protecting against lawsuits or complaints because they document what we did. And so these are generally considered protection or can be protection in those types of situations. And so generally, it's important to also notice under the new HIPAA regulations, well, I guess HIPAA isn't that new, it's 2004, I believe, but way back then, in 2004, there was a distinction has been made between progress notes and psychotherapy notes. So progress notes are the official medical record that can be shared with other medical professionals, and it generally has a more limited scope in the sense that there are certain things that are supposed to go into a HIPAA-based progress note, and we're going to go into that in just a minute. But it basically is documenting the symptoms the client had and what you did about that. And that's the main thing that a progress note does. And as the name indicates, you're tracking progress. On the other hand, psychotherapy notes are separate and from progress notes. And these are more for the clinician in terms of thinking through, case conceptualizing, and putting their thoughts onto paper. Psychotherapy notes, if they are kept in a distinct and separate place and file, can be kept separate from the official medical records. So, for example, when another physician is requisitioning or requesting a copy of records, you would generally just send the progress notes, where psychotherapy notes often have basically more subjective impressions that the clinician has, and so these are protected a bit more, and it's really more in rare circumstances where the psychotherapy notes specifically would be subpoenaed, and normally that would be in some kind of legal case where there's been a complaint against the clinician. So psychotherapy notes, if you're going, and you do not need to maintain psychotherapy notes, they are optional. If you do maintain them, they should be kept in a separate file, separate physical or digital files, separate from the progress notes, which are the official record. For the most part, anything can be put in a psychotherapy note. So the rest and the remainder of this lecture is on how to write progress notes, because you can put what you want in psychotherapy notes generally. I mean, obviously it should be professional, but they are really for the clinician, where progress notes have become more standardized with the HIPAA legislation. That was a privacy legislation in 2004. So when you're writing progress notes, you really want to do two things. You want to, balance two different priorities. You want to maximize client privacy, knowing that these are official medical records that can be subpoenaed and shared with other, medical providers, while at the same time you want to document competent treatment and that you're conforming to professional standards of care. So you need to put enough in there to document competent care, for there to be a medical record of what happened, specifically related to treating the diagnosed condition or the focus of treatment, while at the same time maximizing client privacy. So these progress notes are going to contain detailed information about the frequency and duration of symptoms. That's considered, standard medical record information. You also want to include very clearly the interventions that you use to treat symptoms. So you're going to document your competency. The client came in with these problems, and this is the frequency and duration of the problems, and then this is what I did about it, interventions. And then also, if there was any type of crisis situation, such as suicide or self-harm, child abuse, progress notes are also used to document how you stabilize crisis. So that's also a particular area of focus that needs careful documentation in your progress notes. And the good thing about progress notes is that there are now common ingredients to your average progress note, and that's really been through the HIPAA legislation that kind of outlined what should be in a progress note, which is something we didn't have as consistently before these regulations. So the first thing generally is that you'll have a client case number, and in most cases you want to not use a name but use a number, because this protects client privacy so that their name isn't needlessly documented someplace. And as with all medical records, there should be a date, a time, and the length of session. And this is, especially if you're doing third-party billing, it's very important to have this clearly documented. And then obviously you also want to document who attended the session, because that's also very important information. At the typically also there needs to be the clinician's original professional signature with your title, and generally, if you are in training, working under someone else's license, in many situations you'll also have your supervisor's signature there. And then one of the most important things to document is client progress. And so you'll document the symptoms, the frequency, duration of symptoms, and how bad were they this week, where did they happen, is it better and worse than last week. So these are the types of things you would document. And then also the interventions, again, what you did for that. Typically there's also plans for future sessions. What are you planning to do next week based on this week? And again, if there were any crisis issues, you'll want to go into some detail documenting what you did to stabilize it. And then if you've identified a crisis such as self-harm, week to week checking in about whether or not there was future self-harm as therapy progresses. The nice thing about progress notes is that once you understand the basic ingredients, no matter where you go and where you work or what agency you're at, if you look closely below the different formats, you will find they all pretty much nowadays, after HIPAA, have very similar ingredients. They're just arranged differently. So two of the more common formats you might find are DAP notes and SOAP notes. And you will see that even though these look like very different acronyms, that the information in them is very similar. So the DAP note stands for Data, Assessment, and Plan. And so the data is generally, and again, different agencies and clinicians can put different things here, but generally the data is going to be some content about what happened to the client since the last session. In the assessment, you'll generally put the duration, frequency of the symptoms, whether things are progressing or if there's been backsliding for whatever reason. And then the plan is, what do you plan to do next week, and or revision to the treatment plan. So that's your basic DAP note. In a SOAP note, you're going to see is very similar, and SOAP notes are actually frequently used in the medical community. And so there you'll see a lot of different mental health agencies also using them, especially if they're connected with medical communities. So SOAP notes generally stand for subjective observations, objective observations, assessment, and plan. So that assessment and plan are still there. And so I have seen actually that SOAP notes can be used and that slightly differently in these acronyms, even though they look really clear-cut, can be used differently by different agencies. So in general, subjective observations are going to be talking about either the clinician's or the client's subjective report about what happened over the week. The objective observations are going to be focusing on more measurable reports or objective observations by the clinician. Again, the assessment will be focusing on the progress made, whether we're going forward or backwards, and the duration and frequency of symptoms. And then again, the plan will be what do you plan to do next week, and or what do you plan to do with the treatment plan. So these are two common formats, and I will let you know, do not be surprised if you end up at different agencies, that different people interpret what goes in these categories slightly differently. So in my textbook, I have put together a progress note template that you can use that I call the all-purpose HIPAA progress note, that includes all the important HIPAA ingredients, and it's just spelled out a bit more. And so you're going to see at the top of this, there is the initial information that has the client number, the date, time, length of the session, who was present, and it will include the CPT billing codes. And you will note that in 2013, these codes changed for mental health practitioners. So in the second edition, you will see the new 2013 codes, and if you have an older edition of Mastering Competencies, you will have the other codes that were in place for at least 20 years or more. So that's the initial information that you will see. And then you need to fill in the symptom progress, and so that is the duration and frequency and severity of the symptoms, as well as the intervention. So what did you do about it? And then the client response is typically or often also included in progress notes. And so that is, how did the client respond to the interventions? Were they receptive? Was there some hesitancy or resistance? And so there's a place for you to document that there. Then you include your plan and how you handled any crisis issues. And then at the bottom, there's a place, especially for trainees, where you can put in whether you consulted with other professionals and supervision, and or whether you made any type of collateral contacts, such as calling family members or social workers. And then finally, there's a place for professional signatures, which would be your signature if you're an intern or trainee. And then in some agencies, they would also have you have your supervisor sign off on those. So in the next several slides, what I want to do is break down this form and kind of walk you through how to fill it out in a little more detail. So starting with the beginning initial information on the progress note, like I've mentioned before, you want to try to generally use the client number instead of the name. And this is particularly important if for any reason you are at a place where your notes are sometimes separate from the physical file and your notes can get misplaced. I always think it's a great thing if you can actually have the note fall out of the file and land on the floor, and you can look at it and not know exactly where it goes. The only person who would know who that's about is the person who actually wrote the progress note, because it's confidential enough that it's, if it slips out, there's just a little more protection for the client if you do it that way. I know not all agencies will do it that way, but it's good for protecting client information. Then you, of course, the date, the time, and the length of session. And that length of session should match up with your billing code. And then you want to put who was present. And I like to use the abbreviations AF for adult female, AM for adult male, CF, and then an age for child female, and then CM and a number for child male. And the reason I do this, even when you're working with a family, it really makes it much faster and easier. And I don't know any other way to really document without using names so much with a family. So when you're working with a couple or family, it really is helpful. But also, even when you're working with an individual, it is quite helpful. It's very fast to note it, and you can, even if you're working, let's say, for example, with the adult female, you're working with the woman, but she's referring to her kids or her husband or a lover, it's much better to be using abbreviations like this than to actually be putting people's names. And sometimes it becomes even awkward to write out, husband, lover, if they're having an affair. So, it's probably best to not even use that term. So I really find that using these abbreviations can be very, very helpful in terms of protecting client confidentiality in multiple ways. As well as if you do have supervisors reading, it's very quick and easy for a third person to read this and understand who the players are, what the issues might be, because you can have the ages and everything like that. If a woman's talking about an 8-year-old kid or a 16 or even a 22-year-old kid, it just is a very quick notation that makes it easy. So That said, that there are different agencies that have the convention of using CL for client, and that's also an option. So let's see. In addition, we have here the CPT billing codes, and this is the procedural terminology codes are set forth by the American Medical Association, and in 2013 they actually changed all these for mental health. So what you have, the most commonly used ones are 90791, which is a diagnostic interview, and it's generally used for the first session. Then you have 90834, and this is typically used for a 45-50-minute session with the client and or a family member may be present. And so this is your typical psychotherapy session. And there is also a 90846, which is a 45 minutes of family psychotherapy when the focus is for the family. And in the textbook, I list out all the other commonly used codes for mental health practitioners. And these are good to use when you're working generally with insurance companies. They will use these codes. If you're working for something like a large county mental health agency, they may have their own internal codes that they are using. Otherwise, for medical purposes, most people would use the codes put forth by the American Medical Association. The next thing you're going to document, and for many people this is one of the main things to document in your weekly progress notes, is the symptom progress. And so for this you're going to be focusing on duration, frequency, and severity of the symptoms. And especially when using the DSM-5 that has a lot of dimensional assessment, indicating the severity from week to week is particularly important. So indicating whether it's mild, moderate, or severe is a particular interest. So some examples of how you would do this. The first thing to note is that generally the convention is you're going to say client reported or client stated for virtually everything in a progress note. And because obviously almost all the information, unless you're observing it, is based on client report. And it's just important to indicate that you are aware that this is something that the client told you versus something that you observed. So examples of how this might look is the client reported mild depression or depressed mood for most days in a week or 5 out of 7 days. So here we've got the severity and the frequency of the depressive mood symptom. So again, we have here client reports 1 panic attack over the past week. It was moderate severity. So client reports decreased conflict with parents, 2 arguments in the past week. So here, these are some of the different ways that you can document progress, and it kind of depends on the symptom, whether you're putting in how much duration or frequency or severity. But again, you want to get for most third-party payers, and the typical convention is increasingly we want something kind of measurable. Sometimes that's hard, I know, in mental health. But as much as you can define measurable symptoms and try to indicate that as well as their severity from week to week and whether things got better or worse. So once you've documented the symptoms that the client has, to document your competency, you need to indicate what you did, what interventions you used, and what you did to help the client with these particular symptoms. And when you're in this section, I really encourage you to go through and find theory-specific language. This is where you can document your theory and your clinical case conceptualization comes through. And so this is real important to think about how you language this. Because saying something like you discussed work stress or you talked about client fears, that's all very nice and we expect that you did that. But it doesn't actually document that you did something that is based on the professional standards of the field. Because basically a bartender or hairdresser can talk about work stress or fears. So you want to distinguish yourself as rendering some kind of professional care. So this is really where you document your competency here. So again, it's very simple. You just need to cite some of the techniques generally that are listed in the various sections of the book. And that's probably the easiest way to go about writing your intervention section. So some examples can be using solution-focused scaling to identify steps to reduce depression over the next week. So that's pretty clear that you rendered some kind of known professional intervention there. You can also use something like using enactments to practice alternatives to conflict. These are very short but concise, and they refer to professional known interventions that are well respected, and so it does appear as if you did something professional, and so you're documenting your competence, particularly in the intervention section. Now, this next section, client response, may not be included in all progress notes at all agencies, but increasingly you will see this in most progress notes in recent years. And basically, client response allows the clinician to document how the client responded to the session and to the interventions, or to just kind of note what was going on. And so this is helpful in particular to note if there's some kind of tension between the client and the clinician, but it also can be very useful for even you as a clinician as you're sitting down just thinking about what did my client find actually useful, at least seemed on the outside. Rarely do they verbalize, that was the best reframe I've heard in years. They normally don't say something to that effect, but generally you get a sense of what was useful and what wasn't. And I have found that since I've started documenting this on a regular basis, that I just pay a little more attention to what went well and what didn't. So even if you don't need to document this because you're going to have an unhappy client down the road, which I think is how it ended up as something to document, I have personally found that it helps me just tune in a little bit more to what this particular client finds helpful. There's some examples of things that you can write in this space is called something like client receptive to the reframe related to work issues, less receptive to the reframe on the patterns of the relationship. You can client actively engage in enactment, optimistic that they could do this at home. Something like client expressed enthusiasm about mindfulness. So you can use this to just kind of document both for the official record, but also for yourself to notice what's working and what's not working, kind of fine-tuning what you do in the next session based on their response in this session. So in this next part of the note, you're going to talk about the plan. And this generally refers to the plan for the next session, but it can also refer to more long-term plans and goals within the treatment plan. But in most cases on your average progress note, you're just going to put down what you plan to do for the next session or two. So some examples can be that you'll want to bring in like the parents for the next session or a partner. And you can also follow up on a journaling or other homework assignment. If there has been any crisis issue, it's nice to note that you plan to, in the next session, continue to assess for self-harm or suicidal ideation or whatever that might be. So this can actually be often the most practical part for the clinician themselves to, next time right before the client comes, you can, look over this and remind yourself what you were planning to do with this session last week. So a lot of people use this part that way, and also it just creates continuity of care if ever, there are different clinicians involved. So this can often be the most useful part for you. In the next section on the progress note, you will see that there's a place for crisis issues to be addressed. And this, if there are crisis issues, is generally the most important part to document well. You're protecting yourself on liability issues, and you're also helping to document for the client what happened in the crisis situation, how it was handled, and oftentimes, especially if you're an agency with more than one clinician that might be looking at these notes, or if there's a crisis down the road after you leave with the same client, this is the most important part to have documented well, both for your client's welfare as well as in terms of legal liability issues. So what you want to document are any types of crisis issues that arise in session. And so this is obviously, things like child abuse, elder abuse, dependent adult abuse, suicidal ideation, homicidal ideation, reports of domestic violence. This can also include eating disorders, substance abuse. Obviously, any type of self-harm falls into this category. So there are quite a number of different types of crisis issues that can be important to address. And even something like just even announcing that there might be a divorce or something like that, that can also be considered a type of crisis issue and at least a reason to be assessing for other potential crisis issues. So think broadly when you think of crisis issues, not just the major, child abuse, elder abuse, and suicide, homicide. So when it comes time to documenting crisis issues, this is the one time where your notes are going to be a little more detailed and a little more specific. It helps often to use direct quotes from the client. For example, when you are documenting a client who has suicidal ideation, you're going to definitely want to cover, is it a passive suicidal ideation like I'd rather be dead versus a more active ideation, I want to kill myself? Two very different statements, although they sound similar. And so, do they have a plan? Do they have means? Do they intend to do it? All those types of details need to be clearly documented. And also, if you're developing a safety plan, or when you ask about reasons for living, those sorts of things are very helpful to put in quotes. I often have a lot of clients who will say something like, sometimes I wish I were dead, but of course I could never do it because of my children. And so things like that are good to put in quotes. And what you want to have ultimately when you're done with this section is that you're going to document all of the concerns that were actually there and all of the mitigating factors or other things, and so that any reasonable person who reads through your progress notes, who understands the legal, responsibilities of clinicians in your state, would think and arrive at the same decision you made in terms of the action that you take to keep your client safe. So you want to have enough information there. If you end up calling the client in for a suicide assessment and contacting the sheriffs, to do a formal assessment or having them taken to a psych hospital if your state allows that, then you need to have that clearly documented that any reasonable person in your state would have taken the same type of action. And or similarly, if you assess and determine that it doesn't meet the threshold for when you need to take action in your particular state, then that needs to be clearly documented. So any other clinician in the state reading through this would come to a similar decision about what to do with that client and what's going on. So that's the real goal here, to make sure that you're documenting all of the reasons and evidence, and that's where having direct quotes can be particularly helpful. And then you're going to also document everything you did to keep the client safe. So whether you made a phone call to Child Protective Services, whether you've developed a safety plan, what are the basic steps of the safety plan, whether a no harm contract was signed, all those sorts of things. So this is very important. So on the next slide here, I'll look at some ways that you can document this, give you some examples. So here you can see the first example shows how you might, in the progress note itself, document that there was suspected child abuse in the family. And you have the report, the basic summary that the child was hit with a belt on more than one occasion. That there was a child abuse report made and the time and who took it. And in this case here you can see full report placed in file. So somewhere in this client's file we should also find the full child abuse report that would have more of the details. In this next example we have a client who's reported a passive suicidal ideation, I wish I were dead, but quickly denied plan or intent, I would never do it because of my kid. So those quotes there help us understand, what was said, where the client was. Does show that there was a safety plan with 3 names to call. Went over emergency contact for the therapist. So here you can see how that was handled. The next one we have, reported cutting twice a week, developed a safety plan in which a client agreed to use scaling for safety to develop alternative action, when they hit a 7 on the scale. And that the client readily agreed to the plan, so that kind of shows that it seemed, that was kind of client response to the intervention is actually put right there. So you have a sense of what went on. In this next one, you can see client denies cutting this week, no new cuts on risk evident. So again, here, this is what you're putting in the safety crisis issue section. In following weeks, you can also put this under symptoms, I guess, as long as it's somewhere in the progress note. But then there again, once you've assessed a crisis issue, it should appear, at least for subsequent weeks for some time, to show that you have assessed and that there was no evidence of there being a problem, whether it's suicidal ideation or cutting or homicidal ideation, those sorts of things. Usually with child abuse, you're having more formal intervention, but you should still be assessing no evidence, of further abuse. It should be regularly in your file, either under the crisis section here, or in some cases you can also put it up at the top if you're perhaps documenting depressed mood. So you could say no depressed mood or suicidal ideation. You can talk to your supervisor where you want to put it, but I would say the progress note should have it in one place or the other. So finally, the last thing you might want to document, and maybe not in all work contexts where you document such things or all elements of this, but if you are getting supervision, you can, or some form of consultation, you can document those recommendations or information that you got from your supervisor. Similarly, if you make collateral contact, so that's calling family members who are not in treatment, social workers, physicians, psychiatrists, school teachers, other school personnel. So if you're calling anyone in relationship to the case, you should be documenting that in your files, and often it's called a collateral contact. And it's useful to also know whether or not you have a release of information that's there to help remind you that you should. But so documenting the contact with other professionals or family members. And then finally, there should be a signature, and generally what is expected is that it is an original signature and an original date. Generally you include your license status, and in some situations, if you're being supervised, your supervisor should also be signing the progress note. But initials are not usually acceptable on progress notes as a way of signing off. So you do need that original signature. So that's basically, in a nutshell, what's on a progress note or in a progress note. Finally, I just want to end with a few real practical suggestions and guidelines about writing progress notes. The first is, and this may sound simplistic at first, but it is writing your notes on a daily basis, and generally, obviously, immediately after the session is best, but to really make it a practice that if you are seeing clients, that before you leave the building or whatever work site you're at, that you always do those progress notes before you leave. And that's clearly considered best practice, and it generally is expected. And if you ever can't do that for whatever reason, and there will be a handful of days maybe in your career where that will happen, and when it has happened to me for whatever, usually there's another crisis that I'm trying to attend to of some form, it is amazing how hard it is to recall what happened yesterday in session, and you really do not recall it with the same accuracy and clarity. Now, if you only are seeing 2 or 3 sessions in a week, maybe in the beginning you think you can get away with it, or maybe it's easier to do, but certainly once you end up, after you have a full a load of clients, that becomes nearly impossible to do. So it's very important that you make it a practice to always be doing those progress notes following on the same day that you see those clients, and that is just, I don't know how to emphasize how important enough that is. And I hear people talk about how they don't always do that, or they're out and about, or doing it in the field. It's still important to make it happen and to organize your professional life so that on a very regular basis those are done every single day. And if for any reason you're at a work site that makes it very difficult for that to happen, you really need to be having a conversation with your employer, your supervisor, because it really is an ethical issue that those should be done each day. And if for any reason they're not, it should be documented when they actually were done, so that it's clear when we see a date where the note's done that's after the date of the actual session. That's also a sign that these notes may not actually be all that accurate. And that is how they would be interpreted in a legal setting should it end up there. So it's also important to know that, as you probably do, and we just can't say it enough, that all progress notes belong in a locked file when not in use, and so that's very important. And I want to add to that anything with client information should be locked when not in use. And so that includes, little notes with client phone numbers, or even sticky notes with client phone numbers. anything with client information should be locked up when not in use. And in this digital age, that means password protecting, at least with one level of password protection. And so if you call clients at all from your phone, if you use your computer at all, you should be speaking with your supervisor or employer about standards for password protecting, at multiple levels usually, to ensure client confidentiality when you're using digital devices. It's become much more complex in some ways with the advent of iPhones and email to really protect client confidentiality. So it's an art that I think it's a real challenge to keep everything confidential as the digital technology kind of explodes and what we can do and where our emails can end up. It's even more important nowadays to really focus on client confidentiality. In general, you keep client records for 7 years past the age of majority. That means past the age of 18 is a general guidance for how long to keep these records. And so that's an important thing to keep in mind. And for someone who's been in private practice long enough to worry about these things, it's really nice if when you're closing out the files, you can put, what's the destroy date on it so that you can organize them that way as you archive them over the years. Just a little note you may put under your cap for years down the road. And that is it. So hopefully you've feel a little bit more comfortable and confident in terms of writing progress notes and have a sense of where to go and what to do with these. And I wish you the best. And I know that should you stay in this field for any length of time, you will be using what you learn in this lecture for years to come. Thanks so much.